Hello, my name is Dr. Jack Saroyan, and I'm a member of the faculty of the University of Pacific Dugoni School of Dentistry in San Francisco. I've come before you to demonstrate the use of dental floss. As you all know, brushing alone does not remove all the food nor the bacteria that remains in between our teeth. So we need something else, such as floss, to get to that bacteria. Now, if you were to ask a patient or friend whether they floss or not, they would tell you they did floss or do floss. But most people do not floss correctly. I will show you how to do correct flossing that will make it easier and more thorough than you may be doing presently. Here you can see I'm taking off a length of floss about 28 to 30 inches long. Dental floss in the hands of a dentist is an instrument, one that you need to learn how to use properly. These are my anchor fingers. I don't hold it with my thumb and my first finger. I balance it on my thumbs or my index fingers, or a combination of thumb and index finger. On one side of the mouth, one hand goes in. On the other side of the mouth, the other hand goes in. And I'm demonstrating the C shape, which the floss must be circled around the tooth to get the whole side of the tooth. Here I'm pushing back on the mesial and pulling forward on the distal of the other tooth, scraping. I recommend practicing flossing in the bathroom in front of the mirror. That way you can see whether you're doing it correctly or not. If you hold the floss at an angle when you go in between the teeth, a 45-degree angle, it passes through the contact area much more easily and coming out as well. The proper space between the fingertips is about 1.5 to 2 inches. In the front of your mouth, it should be shorter, but as you go to the back of the mouth, you have to extend the floss somewhat greater between your fingertips to reach the back areas of your mouth. On the left side of the mouth, the left hand goes outside the mouth, the right hand goes inside the mouth. I recommend flossing and mastering the upper teeth first, the upper front teeth, the anterior teeth. Once you've mastered the front teeth, then proceed to the back teeth. They are harder to do naturally because they're harder to get to. Here again we see pushing back first against the mesial, then pulling forward. Here we're seeing the sawing and the pushing back and pulling forward. I'm scraping 3 times on each in-between for a total of 6 scrapings per interproximal area, balancing the floss always on the tips of the index finger and or the thumb, both index fingers and sometimes a thumb and an index finger. This way, you can reach all the way to the back teeth. Unfortunately, most people try to hold the floss between their thumb and index finger and are unable to get all the way to the back of their mouth. Thank you for your attention.